Welcome to Minor Specialty, a podcast for nurses who want a clearer view of what's possible in this profession. Real nurses, real stories, and real possibilities. Hi, welcome to Minor Specialty Podcast. I'm Rebecca, your host, and today I am so excited to bring to you a nurse that I've met a while ago, and we've shared our experiences, and she does something absolutely fabulous. This is Lori. Lori, please introduce yourself.
Hi, my name's Lori Schellenberg, and I am a nurse, have been a nurse for 45 years and a certified case manager for over 20 years. So that's kind of where I ended up in my career path, which was a really good direct link to becoming a patient advocate because the skills as a case manager are like huge for being a nurse advocate. Just a little bit about myself. So going from bedside nurse, having 4 children, a husband that's a firefighter, was a firefighter, shift work for both of us. Rebecca and I have talked about this and pivoting and taking advantage of all the skills that I acquired with each pivot has landed me right here after 45 years doing what I've always loved, and that's advocating for patients and families and also advocating for nurses. So in a nutshell, my business that I own now is called Stepping Stone Advocacy Services. Been around for almost 5 years now. So they say if you can make it to that
Yeah.
5 year mark, you'll make it. 5 years in, I was pursuing the main part of my business, which is the advocating for patients and families, but part of my mission was also advocating for nurses. So how do I do that? I ended up a year and a half ago launching Stepping Stone Nurse Academy, that's where Rebecca and I met. And that was where I was developing courses to introduce nurses to different career paths. But over time, I realized that really what I wanted to hone in and specialize and really focus on was advocating for nurses and mentoring nurses, coaching nurses that wanted to become nurse advocates, either owning their own business as I do with Stepping Stone Advocacy Services, or working for someone else that has an advocacy business or company that does. I can talk for different ways on that and in the different opportunities you have. And so that's landed me here, and I'm excited to talk about it with you.
Yeah, and Lori, I know you actually walk the talk or talk the walk, whatever you want to say. You are an advocate personally yourself. You're not just having this business where you're bringing nurses in that can also do what you do. You are actually yourself an advocate too, correct?
Yeah, so I think it's important. My ultimate goal was to train nurses wherever they are and then market that advocacy where they were and my business around my nurses. But I've kind of stepped back a little bit, and I still carry my own cases. And what's really fun about being the owner of the business is I get to pick and choose the cases that I will keep. And it is funny because I'm the one that's doing the initial interview intake, discussing like an action plan of where we could go as a patient advocate to help a patient and a family. That connection up front, and it's an automatic, they trust me. So then if I try to hand it off to my nurse, then they're like, well, we want you to stay on the case. So, it's educating the communities and patients and families about the roles and the background that each of my nurses have. And I'm so proud of that. I'm very proud of the nurses that I have working with me. But I also really am proud and feel good about being a patient advocate day to day and working with families.
So let's talk a little bit about what that is, because I know we're nurses and nurses are listening to this and we advocate. But what does that mean? I mean, you have a nurse that's working at the bedside, right? And
Mhm.
they're advocating at the bedside for their patient to the doctor because they're with the patient all day. So now explain to me what a nurse advocate now does when they're being an advocate for the actual patient.
Yes, so that's a really good question to ask because it really gives you a picture from that point of view from bedside to advocate. Because think about the bedside nurse and that limited scope of time, limited focus of whether you're a critical care nurse, whether you're, a rehab nurse, whether you're a discharge planner, think about that specific role. And you talk about it in your podcast, a lot of the different roles that these nurses play. Any one of these nurses in these roles can make a wonderful nurse patient advocate, bringing those skills. We all bring skills as a nurse, but particularly if you're thinking about these silos of care in the hospital, when when you say goodbye, when they're discharged or they're transferred to another floor, that is where your responsibility to advocacy ends. So what's really cool about being a nurse patient advocate is that we get to walk with the patient and the family throughout that hospital stay, throughout going home, throughout going back to their doctor's appointments. We get to be their voice. And I love it when I get a patient that's in the hospital because then I get to help with the whole spectrum of care, from ICU to hospice, death and dying. I get to do all of that sometimes. And it's an amazing honor to me that I didn't get to do in the many different roles that I've had in nursing. And I have seen what an opportunity it is for nurses. And that's why you don't have to be a nurse, and we can get into that a little bit more. But to be a professional patient advocate, you do not have to be a nurse. You just have to have lived experiences, walk the walk. Say your grandmother had cancer and you took care of your grandmother for 20 years, and you've learned so much about how to do that, that you can become a patient advocate and you can get certified because you don't have any initials behind your name. So a lot of advocates, they'll get certified in case management and patient advocacy. But as nurses, we have an RN behind our name. And that is, when you think of a nurse, you think of an advocate. So it's such an easy pivot for nurses. You just need to have a little bit of guidance. I started from nothing and went through the process, had to figure out about the business side and joined AFA, Alliance for Professional Health Advocates, and then ended up developing, once I went through it and I started my company, developed a little preceptorship for them because I already was thinking, oh, this is something for other nurses. I don't want other nurses to have to rework the wheel. So it's like,
Right.
and so when I built my own company, I kind of was keeping in the back of my mind then what I could do, because for specifically nurses, there are courses out there. AFA has one. There's several people out there that do courses too, but mine is specifically focused just on nursing and is focused on my experiences that I live day to day because I'm still doing the advocacy work. And so I bring that lived experience to the training and the advocacy. And I think that's what makes what I'm trying to do. I think I was telling you, so my latest pivot is an initiative that I just started this month. It's called the Nurse Advocate Initiative. And it is to help foster nurses and support nurses in roles as nurse advocates. So
That's
that's
great.
what
I
it
mean,
is.
that's such important work, actually. You as nurses, we are advocating for the patients. And yes, when it ends, when you leave and you're often wondering, oh, hope that family did well. And if you get the opportunity to do some great discharge planning as nurses do, and, be able to say, follow up with this, follow up with that. And sometimes you just wonder. And then what about all those private duty nurses as well that work private duty, in the homes, and their patient gets admitted and they don't usually follow them sometimes. But when you're an advocate, you can do all of that because really you're patient centered for that patient, but also family bring you on,
Yeah.
correct?
That is my main. We do get referrals directly from patients more and more now as communities are becoming more, the public consumers, healthcare consumers are becoming more aware that we're out there. So we'll get more and more. But the fact still remains we have an aging population, and a lot of families are taking care of loved ones, and they're the ones that make those referrals for us. Yes. And so we walk with the families, and it is an honor to do what we do. And it's no different than the nursing we've always done. It's just not hands on. You're doing the care management, you're doing education, maybe doing some research, helping them to navigate. So it's what we do every day anyway. And that's what was so, when I first learned about patient advocacy from a friend of mine that was in HR, when I retired, I thought I was retiring. I had
Yeah.
kind of come to the end of my career, and you kind of get kind of tired. And as I was feeling less empowered in my last job and really feeling like I had so much to give, but I was being held back by so many factors that were beyond my control, that I just decided, okay, I'm not gonna, I think I'm done, but it didn't take me very long to realize I really wasn't done. And I did, but I was kind of lost. And that's what's really good about what you're doing, Rebecca, and what I was trying to do through the academy as well, and still with the initiative, is to let nurses know that there's a lot of different things out there. And when I found out from a friend about who was in HR, who actually, when I called her, I didn't realize that her and her sister like were huge into the patient advocacy role, because their mom, they had not a good experience in the hospital, and they ended up creating a nonprofit. It was just fate that I
Mm.
actually reached out to her, and she's like, Lori, I think you really do you know about patient advocacy? And
Yes.
I thought, I think I say this a lot, but I'm like, well, if you're talking about the advocates in the hospital, I said, I did not have good experiences with them. Even though they were lovely and attentive and listening, I never got problems. At the end of the day, they would say, send me an email and say, yeah, we looked at your problem, and we think everything that should be done is being done. And I just felt frustrated with that. And that is one of the things that families feel, is that frustration. And that's the reason they pick up the phone and call me as an independent patient advocate, because I'm being hired and paid for by the patient and their family. So it makes it different.
And you're bringing the knowledge that we have, the experience and the knowledge. So, yes, I mean, how many times even before you did advocacy that a family member would call you and say, "Hey, Lori, I have a question for you. This is what the doctor's doing. Does it seem right?" So now, as a patient advocate, you're like their family member. You're the one that's helping them and saying, what is right and what maybe can be done more or anything like that as an advocate.
Right. You do. I always I'm kind of like the daughter. What
Yeah.
you would do, you think about the little things that you do for your mom. And I am an advocate for my mom. I was for my dad. That was another driving factor, because I had to walk the journey with both of them. My dad's passed since, but my mom has been having healthcare crises for the past year. It's been really tough, but she is such a cheerleader for me in the advocacy role. And she'll call me and she'll say, I know I'm supposed to know this, but can you tell, she knows that. Or she'll say, I have a doctor's appointment coming up, but I don't feel comfortable that I can ask these questions. Can you come to this appointment with me? I'm like, and she'd laugh and she'll go, yeah, you taught me well. So
Yeah, I mean, how many times have we told patients, and I know, like when you're talking with patients and you're saying, you only get that few moments with the doctor, write down your questions so that way, you are getting everything. Even if you couldn't make an appointment, I would think that you would help the patient write down the questions so that they could even hand it to the doctor. I mean, that's all part of it.
it's all part of it. And I think there you have to be creative in how, just like you do as a nurse in the hospital, like how many of us figured something out. If we needed to accomplish something and that particular thing wasn't working, all right, well, let's figure this out. How can we? And it's the same in patient advocacy work, because every case is different, every patient is different, every circumstance is different. So how do we overcome the barriers in healthcare? How do we fill in the gaps in care? And it's a lot of times being creative. It's using resources that you have. I think that's a lot of it. And having the opportunity as a nurse to do that, like to actually get to do that, like your patient's paying you to be creative and figure this out.
Yeah, that's wonderful. It seems like a win-win for both sides, the patient and the patient advocate and the family, or
Right,
all
right,
sides all the way around.
right,
So,
right.
is this so you can do this full time, but it's also good as a if a nurse is working and wants to try patient advocacy.
Yes. So I often recommend this. Start looking before you give up your day job. Now, in my case, I gave up my day job, but that's okay. But start looking. There are options. I suggest I still it's hard. It's hard to make this full-time work. It can be done. People do it. I don't want to be full-time because of where I'm at in my life. So it works really well for me. It doesn't mean that if you're a younger nurse with a family that you can't do this. But what I would recommend is to take some courses, get educated, find out more about what it is. And then there are several companies out there now that are working with Medicare on a Medicare product that has community health workers, and they have what they call patient advocates. Again, you have to remember you'd be working for an insurance company, i.e. Medicare. So the empowerment that you have as an independent patient advocate is not the same. Now, the roles that you're trying to meet and help with are the same. You're trying to fill in those gaps in care, and that's what the program under Medicare does. And there are several companies out there that are now engaged. This is new. It's only been within the last year. That's a way to start too, get some training that way. Salaries aren't as high, but it's a way to get in the door. And so for me too, I sometimes hire the nurses that I've trained, but it just happens to be that we're a good fit and that I have a need, and I've trained them for 3 months. And so it's a win-win for both of us.
Hmm.
But so there are opportunities. And, if you want to start your own business, the coaching and mentoring that I do can either be an hour with me and the self-paced program course that I have, and then we can talk through it. Or you may say, Lori, I know I want to do what you're doing, and have my own business. And
Yeah.
um, during that time, I teach you not only the work of and the job that is, but also the business side of it so that you can turn the lights on yourself. And that's kind of just why I am doing what I'm doing, because I love doing the patient advocacy side and advocating for nurses. So
Right. And so, what type of nurse would really thrive in a patient advocacy area?
So this is a little tidbit out there for some nurses and why it was an easy transition for me. First of all, being a case manager, because you have to navigate and know,
Hmm.
but doesn't mean you can't do it in any other field at all. But I was a workers' comp case manager. So I already knew how to work like an attorney on retainers, how to bill my time, because as a field case manager, we have to bill our time, which was a whole learning curve 25 years ago for me, but it's
Hmm.
second nature. So I find that that is a great advantage for a nurse if she's been in workers' comp or case management, because they understand how to do that, how to navigate. That being said, there are so many niches that you can go into as a patient advocate. I mean, you can be an oncology patient advocate to help people
Okay.
navigate that. You can be an acute care advocate where you just help patients and families through that hospital stay. That's maybe your niche. You can be rare diseases. A lot of people that work in a rare disease environment, they do well. It really is wide open. And that's why I think it's just a really good, it's an opportunity. It's not the same opportunity where, like you had a nurse that was a critical care nurse. So on here recently, and that is a role where you can specifically go and apply at different hospitals and get that job. Patient advocacy, we've only been in existence as a profession, maybe 15 years or so, if
Mhm.
that much. So, and so we're
Still evolving.
evolving,
Yes.
but I think, we're going to get there. But as far as like pivoting for nurses and career decisions, you have to kind of see a bigger vision because you're not going to get handed it right away. You're going to have to learn a little bit more about it. And
Yeah,
that's
so
why I offered this.
right. And the recommendation really, if you like, someone listening to this and says, that sounds something that I would love to do, it's the recommendation would be like to maybe get a course first, to like find the course, go look for those certifications or not even certifications, just a course on what advocacy involves so that even though we're coming with so much knowledge and experience in the advocacy that we do, it's good to have the whole picture of what an advocate would do for a patient and families. I can definitely see, like, even in pediatrics, where families just, you
Yes,
know,
I have a peds nurse. I have actually two
yeah,
peds nurses.
yeah, because
Um,
families, especially when you're so busy, usually people with young kids are working. Sometimes both, adults are working, and you want to make sure that your child's getting the best, but it's not your area of expertise, and so good to like have somebody on your side to be able to ask questions to and talk to
Yes, it's
do
very
that.
important. And that brings up you're a school nurse. Your background is in school nursing. And I think I've shared this with you. I ended up doing a little educational advocacy, advocacy for someone. And because there was an issue with an IEP and diagnosis and med management and things like that. So I got a call to do that. So I think even like a school nurse, like
Right.
they have a unique background and there is a unique niche to do that. And I was going to do it, but that's stretching into another part. I could go on, and that's what we were talking about how to really
Yeah.
hone what you want to do. And
Right, right.
but
What
that's just another example of a direction that a school nurse could go into
right.
as a patient advocate.
I'm glad we brought that up because it's a wide area of where you can advocate,
Yes,
and where your heart is and where you actually thrive and do the best.
yes,
And then,
yes,
so, as we know, if we're liking an area that we're in and we want to help other families navigate this,
yes.
that would be a good thing to do. And yeah, it's good to even try, just if you're talking about a school nurse, this nurse can actually try that over the summer. Hey, maybe let me try the advocacy over the summer. We're coming up on summer now. Let me try
Let
this
me
and
let
see
me
if
learn
it's
about
something.
it a little bit. So
Yes, learn
if you have
about it.
anybody out there listening, yeah, I have somebody that's waiting till the end of June to start because of school and kids or whatever I forget what, but part of career transition is being intentional, right? That it's
Mhm.
important to set a roadmap up. Used to talk about this in the academy all the time. And what I'm trying to offer is a roadmap for nurses to pivot to become nurse advocates, whether they have their own practice or they work for somebody else. And also to spread public healthcare consumer awareness that we're out there and that we are there to be that a person or that company that helps patients and families navigate the healthcare system.
Yes, it sounds like a good thing to get out there and tell nurses and
Yes.
families and everybody that we're out there, that you guys are
Ye-
out there. Let's
Yes.
talk a little bit about challenges though, because we talk about how wonderful things are, but I always just want to be transparent on what are some of the challenges that somebody would see if they were a nurse advocate.
I think one of the biggest things that it's just a good segue from what we were just talking about consumer awareness that we're out there. It's a challenge to get your name out there and to become reputable and grow your business. And that all is more to the business side. And that's why it's really important to have a coach that walks with you and is invested in you. And part of what I've kind of changed in how I approach this is to not only coach, but to invest in them and invest in their future in advocacy. So helping them to understand whatever it is that their niche is, and helping them how to amplify their message to who they are and to become reputable and known for that strength that they have. And that takes time and support. And that was a big challenge for me because I really didn't know how to use social media, or how to get the word out. So the business side of it, probably the nursing side of it, the advocate side of it, the challenges are the challenges with dealing with anybody in any public. As a nurse, you get all kinds of patients. You get all kinds of, they bring their own whatever to the table with you, personalities, family dynamics, all the same things you deal with in the hospital. So I think having those communication skills helps to be able, and that psychological counseling kind of background helps to mental health nurses do very well in patient advocacy work too. All of the skill sets that we all bring are important. So the biggest challenge by far, the biggest challenge for me was generating business because
Yes,
we're
I
not
get that.
trained to do that.
Right, right. So it's good to have somebody in your corner to help you with those things as well. But then I also, you mentioned that when you're an advocate, family dynamics sometimes can probably be a challenge.
Yeah.
Same things that you're navigating when you're working with families in your
Yep.
workplace. I was also came to mind was thinking home health because I remember when I did home health,
Me too.
families loved you and they always wanted you to sit down for dinner with them, and you had to run off to your next case and you couldn't really do that. But in an advocacy role, you are that daughter, like you said, and you can do those things. But the rewarding part of it sounds like it's definitely there, the rewards outweighing the challenges that you just navigate through.
Yes. Like I said, becoming a business owner has been the biggest challenge, the biggest challenge, understanding the legal. So, we were talking about this. You have to learn how to use technology to it's from what kind of software program do you want to do your billing and your documentation? How do you bill? How do you set up your contracts? And how do you manage the financial side and what that looks like day to day. But it can be done if you just take it one step at a time and don't feel overwhelmed. And that's what I try to do is like, let's like really break this down. For this week, this is what we're going to look at this week. And I'm not a special, like I've been doing this for 5 years. So as a coach and mentor, that's what I do. But, there are so many people out there that can help, that are business people. I rely on a lot of help from different sources, and have my village around me to help me to do what I do, which is advocate for patients and families.
I was just kind of thinking on your day to day, like just a certain day to day situation. If you were to call a doctor's office on a patient's behalf, does the doctor's office often like say, well, I want a form saying that I'm allowed to talk to you? That's something you send over to them, and then you continue the conversation. Is that something that typically happens, or what has been your experience in that?
Yes. So when you start your business, every patient advocate should have a service agreement drawn up by an attorney. So all this legal stuff really made me nervous in the beginning because I'm like, I don't even know I've never even called an attorney. So in the litigated world that we know in malpractice, it's very scary to reach out and talk to an attorney for the first
Mhm.
time. Yeah, setting up a service agreement where you talk about confidentiality and you talk about your scope of your practice. All those kind of things are very, very important. And one of the things that we talk about is, securing consent forms. And so when you're meeting with a patient and family for the first time, there's certain steps that you do onboarding the patient. And one of them is getting consent forms signed. It's easier now with the portals, the patient portals. When I first started in case management and workers' comp 25 years ago or whatever, you had to get the forms and then it was just You wanted to get hospital records,
Oh yeah,
it's
you had to be
awful.
on site a lot of times, been
On site
yeah,
just to pick up the records,
right.
right? So now with portals, it's still not good because the portals don't talk to one another. So you still need a patient advocate to take the records from five different specialists and pull them together to be able to read them and then keep them within your software, so that you can then work with the patient. So that was a good question because that is medical records is a huge they're developing policies now on how to make give the patient records over to the patients, like, and have a way to communicate all those portals to the patient. They're working on that now, and that your record then truly belongs to the patient and the family. But it's a start with the portals, and they sometimes give me permission. You can set permission for somebody to have access, and then I can go in and get my own password, and or sometimes they get their medicals and then they can send them to me to put into my, now that they have access to their records, they
Hmm.
can get them to me too. So it's more giving that to the family now.
Yeah. So like a lot of working pieces in becoming a patient advocate, but it does sound rewarding
Yeah.
for the advocate and for the families. I think it's a win-win in so many ways.
Yes. Yes, it
Yeah.
is. And with AI coming, for instance, I can probably use AI within my software program to then arrange all those records and then have AI organize them for me. If you've got ENT back in 1984 over here, we got to use AI in that way to organize.
Organize
I mean,
them.
that's an
Yeah.
example of smart use of technology, but there's always going to be that touch part. Same in nursing. We have these discussions all the time, right? In our field of nursing that, oh, robots going to take over everything? And
Right.
no, ultimately, no.
Yeah, we'll see how it all evolves. Hopefully it's more around for to help and, organize things.
Yes, yes, yes,
So finish
yes.
the sentence. A minor specialty is perfect for nurses who,
Are looking for a career transition and taking all the skills that they already have and utilizing them in a way that brings them joy.
I love that. So tell me, how can people find you?
Yes, you can find me on my website, www.steppingstoneadvocacy. And you can contact, my phone number is on my website, and there's also, you can contact and send me a message as well.
Beautiful. And we'll put that in the show notes so that they can find you too. So they don't,
Okay.
if they're driving right now, we don't want you to stop and
No,
write that down.
no,
So
no.
we'll put it in the show notes so they can find it later. But it's been absolutely amazing talking to you about patient advocacy. I think it's a great place for nurses to look into if they're, finding this is where their heart is pulling them to, and
Yeah.
or even if they're naturally just doing it, because a lot of nurses will find themselves that they're naturally doing it. So, and there is a road to get there that we've talked about, and finding, somebody like you or other
Yes,
courses as well,
yes.
and helping people that navigate this, that they didn't go to school for this, and we have it already, that knowledge, and sometimes we forget that it's second nature to us.
We do. And we don't even realize how valuable it is because we just do it.
Yeah, exactly. Well,
Yeah.
thank you again, Lori. I love talking with you as I always do. We'll talk more in other times, but this is valuable for nurses. So I so appreciate you coming on the show.
Oh, and thank you for inviting me. It's a pleasure.
I hope what you heard today gave you real insight into this specialty and helped you see what's possible for your nursing path. Please subscribe so you don't miss what's next. And tell me, what specialty should we feature next? If you're a nurse in a unique specialty that you'd love to share, apply to be a guest on my website. I'm Coach Rebecca. Until next time, keep exploring.